Vitamin D, the nutrition source. Vitamin D is a fat-soluble vitamin that our bodies produce naturally in response to direct sunlight. Vitamin D is essential for our bodies as it helps us absorb and use calcium for strong bones and teeth, and maintain healthy nerve and muscle function. Vitamin D is important for us because it helps our bodies absorb and use calcium and phosphorus, two minerals essential for strong bones and teeth. Vitamin D also helps maintain healthy nerve and muscle function, and supports the immune system by helping our bodies fight off infection. In addition, vitamin D plays a role in regulating mood, reducing inflammation, and helping keep our cells healthy. Getting enough vitamin D is important for us and our overall health, as it helps our bodies absorb and use calcium and phosphorus, two minerals essential for strong bones and teeth. Thus, our bodies rely on direct sunlight exposure to make vitamin D. Additionally, those with darker skin tones may need to spend more time in the sun in order to get an adequate amount of vitamin D. It is also important to note that individuals may need to take a vitamin supplement if they do not get enough sunlight, are over the age of 65, or have certain health conditions that interfere with the body's ability to absorb and use vitamin D. Supplements are available in a variety of forms, from capsules to drops, and can be taken in addition to a balanced diet and adequate sun exposure. In conclusion, vitamin D is an important fat-soluble vitamin that our bodies produce naturally in response to direct sunlight. It is essential for our bodies as it helps us absorb and use calcium for strong bones and teeth, and maintain healthy nerve and muscle function. It also helps our bodies fight off infection and regulate mood. While getting enough vitamin D from diet alone can be difficult, it is important to get an adequate amount of sunshine and/or take a vitamin D supplement to ensure our overall health and well-being. What are the symptoms of a vitamin D deficiency? A vitamin D deficiency may not show symptoms for months or even years, making diagnosing it challenging. Low vitamin D levels may play a role in your frequent illness, mainly if it's the flu or the common cold. According to a number of sizable observational studies, there is a connection between a deficiency and respiratory tract infections like colds, bronchitis, and pneumonia. A recent study found a link between vitamin D deficiency and an increased risk of developing COVID-19 and its severe consequences. One of the many things that contribute to fatigue may be a vitamin D deficiency. In contrast to less obvious factors like stress, depression, and insomnia, vitamin D deficiency is frequently overlooked as a potential cause of fatigue. Study shows, 480 older adults who had vitamin D deficiency also had fatigue symptoms. A low level of vitamin D and self-reported exhaustion were found to be strongly correlated in one observational study of female nurses. In addition, 89% of the participants were deficient in this vitamin. Two symptoms of low vitamin D levels are lower back pain and bone pain. Vitamin D promotes bone health by improving calcium absorption by your body. In one study, lower vitamin D levels were linked to more severe pain in 98 adults with lower back pain. Your vitamin levels may be too low. Test tube research suggests that vitamin D increases the production of compounds necessary for forming new skin during the wound healing process. A disease or nutrient deficiency may also be to blame for severe hair loss. Research is lacking, but low vitamin levels in women are linked to hair loss. Studies have found a connection between low vitamin levels. According to another review of the literature, vitamin levels and non-scarring hair loss might be inversely related. In other words, the study discovered that hair loss decreased in direct proportion to vitamin levels and vice versa. How is vitamin D deficiency treated or improved? Treatment for vitamin deficiency usually involves supplements. For a severe deficiency, a doctor may recommend prescription vitamin D, which is available in much stronger doses of up to 50,000 IU. The symptoms of vitamin deficiency are frequently hazy and subtle. The most common treatment for vitamin deficiency is supplementation. Additionally beneficial are increasing your sun exposure and eating more vitamin-rich foods like fatty fish and fortified dairy products.